Seema ma'am, one second, ma'am. Seema ma'am. She's not able, she's able to see others, but other people are ಕಾಣಿಸ್ತಾ ಇದೆಯಾ ಅವರು ರೀಲಾಗಿನ್ ಮಾಡಕ್ಕೆ ಹೇಳ್ಬೇಕಾ ಮ್ಯಾಮ್ ಒಂದೊಂದು
Chetra madam, can you hear me?
Yes, sir, I can hear you.
No. 1 minute, madam. Actually, that resource person, the first resource person is trying to log in now.
Right, sir. Fine. We will wait.
2 minutes. Yeah, 2 minutes, madam.
Yes, sir. We will wait.
Yeah, okay. Thank you.
Okay, sir.
Hello. Hi, Chetana. Am I audible?
Yes, ma'am. Hello. Yes,
Hello,
ma'am.
hello. Huh. So, can you please give me the screen sharing option?
Right, so Shidappa sir will enable the screen sharing option, ma'am. I'll just wait. I'll just
Okay.
ask him, okay?
Okay.
Just a minute. Okay, ಹೇಳಿ. Oh my God, where is Shidappa sir? Do they have this screen sharing option, ma'am? I'll just wait. I'll just ask him.
ಅದ್ರ ವರ್ಕೌಟ್ ಮಾಡೋಣ. ಓಕೆ.
Hello.
Yeah, madam. I'm just trying to enable, madam. Can you
Sure.
just wait for? Can you
Yeah,
just wait for?
I'll wait. I'm here. I'll wait.
Okay. Thank you, ma'am. Thank you. Trying to enable, madam.
Okay.
Yeah.
Or else you can do one more thing. My slides are already been sent. Hello, Nandini.
ಹಲೋ ಮ್ಯಾಮ್, ವಿಡಿಯೋ
Chaitanya, I can see you.
Yes, ma'am.
What is the situation there? Are you people able to see me?
Yeah. No. We are not able to see your pic, ma'am, actually. We can see your
For
name.
me,
Yeah.
the video icon itself is not there.
Okay. So we'll just inquire with the tech team, ma'am. Just hold on.
Okay,
I'll just do it as fast as possible.
sure. Chaitanya, what is happening in here?
Yeah. They are trying to enable the video option, ma'am.
Okay.
Okay, in the meantime,
Have they added me as a participant or as a speaker?
panelist. I think they have added you as the panelist, I suppose. Yes, ma'am, they have added you as the panelist.
So the
that,
video should be on actually. I don't know what's happening.
They're working on that, ma'am. Okay.
Okay.
So in the meantime, I'll try to introduce you to the audience.
Sure.
Okay. Yeah, I'll just start with the session, ma'am.
Okay.
Okay. Thank you, ma'am. Okay. Good afternoon, everyone. Welcome to the day 2 of the national webinar, COVID-19 lockdown and the vulnerable population. Today's theme is mental health support, the challenges and prospects. It is jointly organized by the PG Department of Social Work and Internal Quality Assurance Cell, Government First Grade College, Kayanagara. Now I request Mr. Girish V, Assistant Professor, PG Department of Social Work, to introduce the first speaker of the day, Dr. Seema P. Uttaman, Madam. Sir, over to you.
Hello. Yeah. Okay. Thank you, Chaitanya ma'am. Good afternoon, all of you. I'm glad to introduce Dr. Seema P. Uttaman madam to the session. Dr. Seema P. Uttaman madam is a HOD of the Psychiatric Social Work Institute of Mental Health and Neuroscience, Calicut, Kerala. Madam is serving as the member of Board of Studies, Kerala University of Health Sciences. Madam is also guiding PhDs to several students in the Department of Mental Health and Neurosciences, Calicut, affiliated to Kerala University of Health Sciences. Madam is principal investigator in the ICSSR funded project on scholastic backwardness of upper primary students in Calicut district. Madam is, we are proud to say, Madam has recently won Best Teacher Award from Kerala University of Health Sciences. Congratulations, Madam, from our department and from our college. And it is also proud to say that Madam has 15 years of clinical teaching and research experiences in psychiatric and social work. Madam, I extend a warm welcome to you to this session, ma'am.
Thank you, sir. Thank you very much.
Yeah, thank you. Thank you.
Thank you, Girish, sir. Thank you for that introduction. Okay, before we go into the session, I would like to request all the participants to kindly refrain from writing anything in the chat box. If you have any queries that you feel that need to be addressed, you can put that in the question and answer section of the session. So I hope, we apologize. Yeah, ma'am is back. So welcome you, ma'am, on behalf
Thank
of all the participants and on behalf of our college, Government First Grade College, Nagar. So, yeah, I think the technical glitch is righted. So now we will start the session. Madam, over to you.
Okay. I'm just starting the screen sharing, but the host disabled participant screen sharing is what I can see on the screen. So could you please enable me to share the screen? The host has disabled me. Chedna, could you please work on that too?
Yes, ma'am, we are working on that. I have told Siddhappa sir about that. We are just
Okay.
working on that. Just wait for a second.
Okay. So I think we can start now. Very good afternoon to one and all. I'm here to talk about the psychosocial interventions for children with a developmental delay in today's webinar. As most of us are very well aware, the COVID-19 pandemic is continuing to perpetuate an intense and catastrophic impact upon the people in India and across the world over the last few months. In these dire times, it is important to highlight the fact that certain people are facing an additional crisis of understanding and dealing with the present challenges brought about by the pandemic. Children with disabilities and other special needs, as well as their parents or caregivers, comprise one such group that is undergoing a hard time. Supporting children with disabilities at home during the nationwide lockdown does require extraordinary effort and patience. Let me introduce you to the term developmental delay. Children with developmental delay actually refers to children who have not gained the developmental skills expected of him or her compared to others of the same age. You may be aware that there is something called age-appropriate development for every child. And there are certain milestones which each child needs to achieve to call himself or herself to be developing normally. For example, at the age of 3 months, the child will usually start smiling, seeing the familiar faces of parents. By 3 months or 6 months, the child will be able to, 3 to 6 months, the child will be able to uphold his or her neck. And the child usually starts walking by the age of 1 year. 8 months to 1 year, the child will start walking. So these are the developmental milestones, and children with developmental delay lags in achieving these milestones. So as the term clearly says, there is a delay in their normal development. So these delays can occur in the areas of either motor functioning, speech and language development, cognitive functions, play, and social skills. These conditions begin during the developmental period and may impact the day-to-day functioning of the child and usually last throughout a person's lifetime. By this, you will be able to understand how difficult it is for the child who is developing abnormally. And one factor about this developmental delay or disability is it can occur among all racial, ethnic, and socio-economic groups. So it is very prevalent in the current society. And most common kinds of these developmental delays are autism spectrum disorder, or otherwise known as ASD, wherein the child will have difficulties in 3 main areas of their development, that is communication, social interaction, and behavior. These symptoms are usually made to notice by the age of 3 years. And intellectual disability, what happens is there is a delay in the global development of the child. So the child will have difficulties in attaining almost all milestones, including the physical, psychological, and social milestones. Another condition is cerebral palsy, excuse me. In cerebral palsy, there will be difficulties in the muscular coordination of the child. They will not be able to sit upright, or some may not be able to walk properly. They will have difficulties in eye-hand coordination and other things. Another category of developmental disorders are that of learning disability, wherein a child who's developing normally intelligence-wise, having difficulties in learning certain subjects or languages. They will have problems either in reading, writing, or in arithmetic, or could have problems in all these three areas of academics. Another one is speech articulation disorder, where the child may not be developing appropriately during the speech milestones achievement age. They may lag. Certain children will have misarticulation disorders, where their pronunciations are not very clear to others. Children will also have stuttering, stammering, and other things. And the most common and most familiar term is that of attention deficit hyperactivity disorder. I hope most of you will be able to tell what it is. As the name indicates, the children in such conditions will have deficits in their attention and will have hyperactive behaviors. Being said about the commonly seen developmental delays and disorders, we should know what is the general nature of developmental delays, why it is becoming so difficult for children and parents to live further. So the nature of the developmental delays are such that they are, as I have already told, manifested during the early years of a child's development and may last throughout a person's life. Then you can understand how complicated it could be. And there is no non-medicine or cure for such kind of delays or illnesses. That means a person who are having developmental disorders or delays cannot be completely cured with medicines. Research are still undergoing in finding out the exact causative factors for such illnesses. So without knowing the exact cause, people or the medical practitioners won't be able to prepare or plan a treatment modality. But the only proven treatment so far is the training part of children. The training has been shown to be very effective in children with developmental delays. Early identification and intervention often yields better outcomes. That means if a child has a delay, if that is understood at an early age, it will be very easy for the family to start interventions which can yield better results. I'll tell you an example. When a child usually starts talking, the child usually starts talking by the age of 8 months to 1 year. They will be uttering single words. During that period, they may be calling amma, appa, or they may be indicating some of their basic needs, like they want milk, or they want to be lifted, or something like that. If a child is not talking, or if the child is showing some delay in starting the conversation, most of the parents will think that, oh, child is too small, he may develop on his own. So if the parents are under that impression and they keep waiting, and the child reaches the age of 3 or 4, and then they think that this is the time to take the child for consultation, there is a delay in reaching the child to a therapist. So what happens is, an intervention which can be given at an early stage, like if the child is not talking and the parents recognizing this factor at the age of 8 months or 1 year, the intervention will start from then itself, so that the child will get inputs on developing his or her speech. So all other evaluations will be progressing, and the wherever the rectifications are needed, that will be done, and the child will be given speech therapy. But if the child is brought to the therapist at the age of 3 years, you are losing 2 years in the development of the child. So training is still possible, but it may not lead to better effects compared to training which is initiated at an early age. And this another part with the training is that the training should be continued on a regular basis. So once the child is being identified as having a delay in the development and being introduced into a therapeutic intervention, that should be given on a regular basis. It doesn't mean that the child should always be treated in a therapeutic setting. That family members can also learn the therapeutic techniques and can practice it at the natural home environment of the child. Coming to the training during COVID-19, parents and caregivers of children and youth with disabilities are facing unique challenges as a result of COVID-19. For example, while social distancing has been widely promoted as the best strategy to avoid transmission, that advice may not be realistic for people who care for children and youth with disabilities who may require therapy or assistance with daily tasks. So the parents are very closely physically attached to or doing the training part of most children with a developmental delay. So the social distancing and other criteria may not be practiced by them, which can create a stress to them, and they may be also feeling that am I doing the right thing? Meanwhile, children's clinical services and other treatments are being disrupted with the closure of schools, medical settings, and caregiving agencies. So, families' ability to obtain critical medical supplies can become difficult or as resources become scarce. So, these are the difficulties that can happen to any family, and with children having special needs, this becomes all the more relevant. And most of the schools or training centers are closed due to lockdown. Children are forced to confine to their own homes. Movements are restricted, routines are changed. Most of these children will either be attending a special intervention program or they are attending a regular school with a special input. So when their routines are changed, these children show too much of behavioral symptoms. We know for normal children itself, the current scenario is very difficult to cope with. So, needless to say about the difficulties faced by children with special needs. So, due to their disability, they may not be fully able to understand the situation. For normal kids, you can explain that because of the government guidelines, you are not able to go to school. But for special children, it is very difficult for them to understand what is actually happening in the outside world. So that makes the situation all the more difficult. So what are the consequences? As a consequence of all this, children can be more irritable, as I have already told, and there could be worsening of the existing problems. There could be a delay or diminishing in the inputs or trainings being provided by the therapeutic team. So this can actually worsen the existing problems of the child, and there could be increase in behavioral problems because the children are confined to a home environment and they are under close supervision of their parents. Normal life will be totally different from that of the COVID-19 scenario where children will be going to school and parents are attending their own works. But now everybody is made to sit inside the home, and this can increase the supervising from the parental part, which actually can create more distress in children and can have more behavioral problems. And parental stress increases because of these problems, and which in turn creates an interpersonal issue between the parent and child. So it's a vicious circle actually, where the problems in children increases, the parental stress increases, and the interpersonal relationship between the parents and children get affected. Coming to the psychosocial interventions, what are the need of the hours, or what can be done to address the difficulties faced by children and parents having developmental disabilities, or parents of children with the developmental disabilities or delays and the children? So there could be interventions given at individual level, family level, institutional level in terms of therapeutic interventions, and community level. This is broadly classified. And in social work perspectives, you can say that you need to do the casework part, that is the individual intervention, and a group work, maybe individual work with family or group work with the family members, and then some kind of social actions and other things to improve community participation or to improve the institutional level therapeutic interventions initiatives. So coming to the individual level intervention, First and foremost thing is to foster calm in children. As we have discussed, children may be undergoing lots of stress, and they may be distressed because of the lockdown and their lives being confined to the four walls of a home. So the best thing is to foster calm in children. In times of change, opportunities to engage in calming behaviors become especially important. So schedule coping and calming activities into a child's day and consider ways to introduce new calming behaviors. So calming behaviors are such behaviors where the child is not instructed to stick onto a particular schedule. The child will have a lenient time frame where he can enjoy no work time, or he can do or she can do their own activities. So there is no closed supervision or closed monitoring in these kind of times, and the activities which are included under this heading should be pleasurable for the child and does not strictly fall into a clear-cut framework. For example, some of the calm down behaviors and activities could be teaching the child to do basic or simple yoga techniques, or introducing them to music therapy where they can actually sing and or learn singing, or art therapy wherein the child can be more creative, do some paintings, or create some craft activities or something. So this is an hour where the child will have more free time, or more leisure time to do things at his or her own pace. This is called as calming activities. It is always advised, and studies have proven that creating a routine for such children will be very beneficial. If previously established routines have been disrupted, as we have already discussed, there could be disruption in the established routines. We need to tell the families to create new routines for the child. This can help the child to feel more secure and understand what is expected of them. Children with developmental delay actually likes to follow a fixed schedule, because they have difficulties to get accustomed to a new environment. So once they are tuned into such a particular list of behaviors, they are made comfortable in that, it will be very difficult for them to change. So introduction part of this new structure will be having little difficulties, but once they fall into that, it will be easy for them to follow. So when you create a routine or a structure a child's day, care should be taken to balance educational, entertainment, recreational, and sleep, eating. All that pattern should be framed into one schedule. Like from morning when the child gets up till the child's bedtime, every activity should be made into small schedules. Like for example, 6 to 6:30 the child will be doing brushing, toileting, and other things. 6:30 to 7 next activity will be given to the child. So the entire day will be having a structure, and child will know that this is the time for me to watch TV, or this is the time for me to do my homework, or this is the time allowed for me to play. So creating a routine or structuring a day is proven to be very effective. And then you can also introduce new behaviors in the child during this time, because as the need of the hour is on social distancing and hand hygiene practices, it is important for the families or therapists working with children with special needs to introduce or make the children learn such behavior. So how to wash your hands in 12 steps or 6 steps, and what is social distancing, rather than what it is, how to practice it. All that things can be added in the new schedule. And encourage them to talk about their feelings. Most of the people will be thinking whether these children will be able to talk. They are able to talk like all of us. Maybe some of them have difficulties in expressing it in words, but they do communicate. communication doesn't always need a language. They may be verbally or non-verbally communicating to their caregivers, or they will be showing their emotions through certain behaviors. So children with disabilities often experience feeling of social isolation from their peers, and social distancing policies related to COVID-19 may amplify these feelings. So they are capable of judging other people's emotion. They are capable of understanding whether the peer group rejects them or accept them, and they actually belong or allowed to being included in a group. So give children opportunities to discuss these feelings and brainstorm ways for the child to interact with others through texting, phone calls, and video chatting and other virtual platforms. Never ever think that these children are special and they don't know how to interact with others, and we don't have to bother about all their social communication and other things. They do have their own feelings, their own emotions, and it is always good to discuss openly with them about all these things. And if the children say that I want to see my class teacher, or if I want to see my friend, make some platforms or virtual media to be made available so that these children can see their peers or see their teachers and be more comfortable. So coming to the family level, most of the parents will have high expectations about their child. Actually, before a child is born, the parents will have lots of dreams. But when the parents comes to know that their child is a special one or have difficulties with the normal development, that itself creates stress in the parents. And it is natural to be more irritable, and it is natural to lose hope over therapeutic interventions or life as such. But it will be always better to address the parental level stress at when as and when required, or encourage the parents to be empathetic. If, the therapist should be empathetic towards the parents, and also encourage the parents to be empathetic to the children. Ask them to validate the feelings of children and try reaching out to therapists and other families in similar situation to brainstorm ideas to address any discomfort or sensory communication and movement challenges to the extent possible. So when the child is crying or when the child is irritable, validate those feelings and emotions, and if needed, report about all these difficulties to your friends, like families of children with a developmental disability attending a school will have a group of their own, or they will have some support groups. So if it is okay, you report or you discuss your worries and emotions to the similar situation facing parents, or you could also discuss it with the therapeutic team. So it's as a therapist, you should encourage the parents to be empathetic towards the child, encourage the parents to show love. Does all the parents show their love to their children? Of course, yes. But children with disabilities are capable of internalizing the feeling that they and their care needs are burdensome to their parents. How it happens when a parent becomes too stressed, that is manifested through some of their behaviors, which in turn the child will sense that my mother or my father is not happy with me. So during the stressful and uncertain time in which parents may be wearing the hats of the employee, teacher, caregiver simultaneously, this feeling may be heightened. So the therapist should remind the parents to express their unconditional love and joy of getting to spend extra time with the child. There is a concept called quality time, wherein the family members are advised to sit together and do some pleasurable activity without having any evaluations about the academics or behaviors of the child. So these quality times are proven to be very effective in developing bond between the family members. So if the parents are trained to express their unconditional love and joy with children having developmental disabilities, the children will also feel that they are wanted and they can also cope in a better way with such situations. Parents should stay informed, but overloading with media can increase stress. While it is important to keep up to date to the rapidly changing information on COVID-19 in the community, the oversaturation of information can add to stress. Most of us are of the habit of reading everything that comes in social media and worry about that. So it is not advised to parents of children with developmental delays. So they should have information, but they should not oversaturate themselves. To stay informed and keep your family up to date while remaining safe, they can identify a few trusted sources for accurate updates and limit social media use. These accurate informations could be sought from governmental websites or governmental apps. So they will be knowing what is happening, but they will not be overloading themselves with information. Parents should be encouraged to check in with their child's school, teachers, and therapists about how educational and therapeutic service delivery may change in the coming weeks. So, as I have already mentioned, few of the children are into regular schools, few are into special education programs. So, during the lockdown, what is the plan for the school? Whether they are planning to continue their educational activities through online platforms, or are they suggesting something else? So the parents should be in touch with the school authorities or teachers and therapists. And the therapist should also reassure the parents not to feel pressurized to exactly replicate school and therapy at home, because in the school atmosphere, it is totally different and the children are more obedient to a teacher or a therapist than to parents. So if the parents wanted to replicate the entire structure which is followed in the school, it will be very difficult and disheartening for them if the child does not agree or obey to such a strict routine. And with flexibility, they can identify new ways to learn and grow together that would be more difficult in a typical time. So in a typical time, children are at school and parents do little of their work. But when it is in this COVID-19 kind of special situation, there is more flexibility. Parents can be more creative and they can think of new ways in which they can learn together, or how to teach the child a new concept. So for this, they can take inputs from the teachers and therapists. And we should also encourage parents to check in with the child's healthcare provider by calling or using telehealth services if available. This is to get information regarding handling an emergency. For example, if the child is having an emergency medical condition and the entire structure is not permitting you or the child to go and seek services, we should always rely on the helpline numbers available. In that helplines, you can also check with how to access an equipment, how to get supplies, how to get medications, etc., and whether it is best to visit a healthcare facility or stay at home. So if the parent is talking or calling on the helpline and discussing their concerns, the people or trained professionals at the other end will be able to guide them as to what need to be done right now. And the parents should also be encouraged to stay connected with others virtually. They should understand that self-isolation, quarantine, and shelter in place are only temporary ways of being. And they can seek support from those around through social networking sites. And we should always advise the parents to be kind to themselves, since previously available respite options may no longer be available. Focus on what can help feel restored. So parental mental health also is very, very important in dealing with children having developmental delay. So parents should be advised to take care of themselves. This might mean taking short breaks from the immediate stress of the situation. When the child is at school and the parent at their workplace or at home, they will get some time to relax themselves. But when everybody is together in the same household and parents being continuously doing activities of home and office and taking care of a child with a disability, it will be very difficult for them to balance their mental health. So we should advise them to take short breaks. This might mean spending some time watching a favorite channel or to give a brief mental break for oneself. They can listen to music or involve in any pleasurable activity for a brief period of time so that their batteries are recharged and they can still continue with the training of a child with developmental delay. And the therapist should also tell them that there is nothing wrong in seeking help at a time. So disability or condition-specific organization and support groups can provide helpful information, social support, and reduce feeling of stigma. Reach out to local organization to see if they offer virtual support groups or have active email lists that send out information and resources. So the parents should be up to date about all these things. Now, there will be a question like whether all the parents are able to access this online services or online platforms. Many of the parents may not be, but still there are options wherein the therapist can give instructions over phone, not on the visual media, but they can also give information over phone, and that can be helpful to a parent to do a specific intervention at home. There is a situation is such that everybody has a phone with them. So if the virtual platforms are not actually helping a particular parent, they can also use the phone and talk to people, or they can talk to therapists or support groups to de-stress themselves or to seek help. And the therapist should always advise them to be prepared. While difficult to consider, many of the parents will find it very difficult to consider a period when they are away from their children with a disability. But still, there should be a plan to care for the child in case this primary caregiver of the parent is becoming ill. Now the situation is such that anybody can be affected with COVID-19. So if at all the primary caretaker of the child is being affected with a illness, what is the plan for the child? Because typical secondary caregivers may be unavailable, like we have to call the mothers or grandparents home to take care of the child. This may not work because of the current situation. Then it will be always better to have a plan in mind and do it if there is a need. Determining your plan prior to needing it provides a sense of security and reassurance at a time fraught with uncertainty. Coming to the institutional level interventions, most of the children might have been undergoing special schooling. Many institutions are running online classes, but some are not. Online therapeutic interventions and individual education programs should be made available to every child having a disability. There should be a provision to evaluate the difficulties faced by parents, and they should be provided with an on-call video call support in times of crisis. So that is at the institutional level. From the institutions or schools where these children are regularly attending, the teachers will be more able to understand how the child is being trained at a school. So if the same thing can be replicated with minor changes in the routines, that can be practiced at home with mothers as the co-therapists for the main therapists at the educational institutions or at the treatment centers. Coming to the community level, community should be sensitized towards the issues and needs of populations. Stigma towards these children are common. Hope I am audible to all of you. Am
Yes.
I audible? Yeah.
Yes, madam.
It's
Yeah, go
heavy
on.
rains and storm outside, so I don't know whether I am able to be
No, you
clear.
can go ahead, madam. You
And
can
with
go.
this, we are almost ending the presentation. So at the community level, community should be sensitized towards the issues and needs of such populations. Stigma towards these children are common. As we know, children with mental illness or mental health difficulties or developmental delays are being seen as a different group of people by the community most of the time. So as a social worker or a social work practitioners, we should try to eradicate the stigma or misunderstandings among the community, and to they should be made to encourage children or parents with such difficulties. Community should be aware of such children and their difficulties, and if a need arises, they should step and support the family by arranging food, medication, or whatever is the need. With that, I end my presentation, and I think we can wait for the next presentation and then answer the questions if any. Is that okay, Chetna?
Yes,
We can
yes,
wait.
ma'am. Yes, yes. We will wait for the question and answers later.
Hope I
after
have not
receiving-
exceeded the time slot which is being given.
No, ma'am, not at all.
Okay.
Since we had our own technical issues at the beginning, so it was exceeded. No, not an issue, ma'am. It was really a nice presentation. Thanks to you, ma'am. Because, no, as we all know, development delay is a situation wherein a child does not achieve the development, different developmental milestones at the right time or at the expected time. So we shouldn't be confused with the normal lagging behind situation. That also we understood from your presentation. So that is one thing. And the second thing is like you have given a very elaborative explanation on the psychosocial intervention. That was very useful. I think many of the participants have expressed it was very informative. So thank you, ma'am. Thank you for that.
Okay.
Okay.
I'll stop the screen sharing now.
Yes, ma'am. Yes.
Thank you.
Thank you. Thank you, ma'am. So moving on, now we will, Akriti, ma'am, are you there?
Yes, very much. Very much.
Okay, welcome you, ma'am.
Thank you.
Yes. We will have the question and answer session. Welcome, ma'am. Later after this session, this second part of this webinar session. Okay. So now I would request once again, Girish sir to introduce the next speaker. Over to you, sir.
Good afternoon once again. Siddhappa sir?
Yeah, you can hear. Yes,
Okay.
yes. Yeah, go ahead, sir, please.
Okay.
Please.
Good afternoon once again. I'm happy to introduce our next speaker, Ms. Akruti Kapoor, for the session. Madam is a social work practitioner. Madam is postgraduate in social work from Tata Institute of Social Sciences, Mumbai. Madam has 8 years of experience in practice with mental health and mental illness in various hospitals, non-profit organizations, and CSR initiatives. And Madam is closely associated with Haryana National Mental Health Program. And Madam has rich experience in various fields of children, beggar, homeless, environmental sustainability, and social entrepreneurship. Ms. Akruti Kapoor is closely associated and working with COVID situation. Madam is assisting in mental health support, and Madam is also currently working with Samruddhi project. Madam is going to speak on telecounseling prospects. Madam, I extend warm welcome to you for the presentation. Over to you, ma'am.
Thank you. Thank you so much, Girish ji, Chetna and Siddhappa. Dr. Seema, I think as a predecessor, great presentation. It's an honor to share the virtual dice with you. And congratulations on winning the Best Teacher Award. I assume this is the rightful beauty. I'm going to just share my screen and speak about the topic that I have today. Hi, is this visible?
Yes, ma'am.
Yes, yes.
Okay.
Yes, you can go ahead now.
Perfect. Thank you. So as Girish ji introduced, I am a project head at Sambandh Health Foundation, and I volunteered as a program manager with COVID Response, which is the telecounseling service that we started within the COVID space. As I think Dr. Seema has also introduced in many of her slides, we all know the reason why telecounseling is required. But while the time we set up something like this, we don't know who we are addressing it to. The passion of supporting people in the area of mental health is visible, but who and how do we need to cater to that kind of an audience is something that comes in the space of learning as we grow. I have put down certain points that actually addresses the major crises because of the COVID season. It reads as unaddressed crisis can lead to early and long-term onset of mental health conditions, and stemming from and not really limited to the post-traumatic symptoms such as sleep disturbances, hopelessness, flashbacks, disturbances, and substance abuse. The incidences of the PTSD, as many of you may know, is quite similar and to be found after COVID-19 is also over, similar to what SARS as a pandemic in Canada was observed. And with respect to that, I think in the early March, when the COVID season was beginning and the pandemic hasn't even, the lockdown hasn't even started, there was a suicide death associated to COVID pandemic, where a 23-year-old boy who was suspected of being infected with the virus jumped off from the 7th floor of Delhi Safdarjung Hospital. Prior to which, I think Indian Psychiatry Society, many of you might be very familiar with, had did this research and indicated that there will be a 20% hike in the mental illness issues during the whole COVID-19 pandemic, wherein out of 5, one person with an Indian with mental illness will be suspected to support. In one of the researches, it was also found that the rates of suicide is about 170 times higher for people who are suffering from schizophrenia than in any other issues. It is something that is also being published into their researches. Just to give you a little context about the work that we have been doing, at Sambandh Health Foundation, we are a non-profit organization based out of Gurgaon, which is in Haryana. And we primarily work in the area of public health, specifically mental health and tobacco control. And my role specifically work towards, developing the capacity of people with mental illness, their families, as well as to be able to educate and advocate for the better support. While at COVID Response, it is basically an initiative. It's not an organization, it's an initiative that came into being to address the crisis counseling and the psychological first aid. It is being bridged together with Mindpiper and IM in partnership with the Delhi government, where the counseling services could sort of reach down to the maximum audience. I have listed down the lockdown phases. I don't know if many of you may actually know about this, but today happens to be the 100th day of the lockdown, during which there have been many support systems that have opted on. There are a lot of cases of domestic violence. A lot of people with who are the migrants who have suffered tremendously before the transition, during, and specifically after the transitions. They have all experienced extreme mental health issues, most of which have been unaddressed, primarily because of the lack of any accessible facility. Within Sambandh, we work for people with severe mental illnesses, and early on with the sudden lockdown, we anticipated a lot of triggers could sort of release, and to be able to cater to that, there were already a lot of phone calls, video calls, conferences, calls that were being set up so that the people who we are working with don't feel isolated and left alone, and the triggers that comes down to ease them off. Having said that, the major part of our conversation was to be able to get adjusted to the new realities, to identify new goals of ourselves, to actually rely on to the desires that we wanted to learn certain things, do certain things. And now that we are at home, there were possibilities of doing that, and continuously reiterating the idea of self-care and precautions that we all need to take care of during COVID. I would say a lot of families and members who we are associated with have continuously responded and given their feedback for the continuous understanding and acceptance that they've had all during this period, where without judgment, their concerns were being heard, they were being understood and accepted the way the situation was. And I think at that level, what Dr. Seema also said, something like a quality time, That quality time does come in space with your family members, with your loved ones. But besides that, you have to have a circle where you get introduced, accepted, and understood as you are. And that space really helped for the people with mental illness, their families at large. While at COVID, to give you the journey backwards, in March, we started the online counseling service because that was the need, as Dr. Seema has also indicated. If you are stressed out and you do not know, please do reach out to those services. Now, that services that have taken up also need to get acquainted to the new idea of what COVID is, and how your facilities and your services change. Initially, we started with an online counseling platform, but very quickly we realized that this online platform is only limited to a few section of people who will be able to get, who have an understanding of mental health issues, and then will be able to access that facility. But to be able to reach to the larger audience in duration of this lockdown was a telephonic counseling services. Okay. And this is a facility which is now accessible to all the people, because the phone number is easier to dial than to have a net connection and have a session being booked for yourself. Parallelly, COVID response is an initiative where not just me or any other, but it's the whole team of mental health professionals who are contributing their time on volunteer basis. Very initially, when we started out in April with the telephonic counseling services, we had as much as of 50-60 counselors at our deck who were trained in first psychological first aid and crisis counseling. By the time of mid-April, we realized that we had to increase, and our base was about 350 plus mental health professionals who were able to address about 1,000 calls per day. And that is the kind of hike that you increase because of the kind of calls that you receive on a regular basis. And all of this is also possible because of the collaborative efforts. I think from our experience, we've never found that only one organization or one entity in itself can be entirely sustainable. And hence you require support and collaborate with different organizations, also within the field of mental health and otherwise, who can reach out, create the awareness, and ask people to reach out for mental health support. Initially, our focus has been to provide these counseling services to people who are in quarantine, whether it is self-imposed or government-imposed. The geriatric population, the elderly population, who for them was a very new atmosphere, had to be very dependent on the youth or anything for their provision of services. And they had no other access to gain any kind of other support. So the counseling helpline, the telephonic counseling helpline sort of put their anxieties and a lot of unrest environment at ease. Additionally, you have children, like I think Dr. Seema also indicated. We had children from the secondary and the primary school who were suddenly in this atmosphere of lockdown, figuring out about their exams, about their careers, who had nowhere else to have an understanding, suddenly extremely bored at home, parents not realizing what their concerns are, such forth, and sort of beginning to figure out how their solutions can be within the home environment. People who are actively seeking treatment because they were diagnosed with mental illnesses, and the healthcare workers who were continuously supporting the people in quarantine, visiting outside, and they didn't have anybody else to reach out or access support for themselves. Just providing a very quick summary. By the time we started in April, we have a total of about 48,000 calls, around 48,000 calls. This number still needs to be updated. But with about 68% of calling rate, and a maximum time has been spent to address different kinds of calls, where about the therapeutic calls that involves above 15 minutes have been about 36%, whilst your 5 to 10% of your call times are being spent is about 29%, roughly 30%. Total hours that have been spent have been about 1,500. In the month of April, the maximum call timing that went out was for about 53 minutes, while in the month of May, the call rates increased to about 2 hours per person. That has been like the average kind of time being spent. A lot of us might actually assume that a lot of females only reach out to counseling services, and not everybody else, because mental health becomes a taboo subject. But contrary to the idea, I think we had a lot of males who had called, accessing for support and guidance, because they were the primary breadwinner who had to figure it out and they didn't know any better. So I think about 67% of the males had called, while about 32% of the females structure had called us. The nature of the calls that we received were largely surrounding the food and the ration related issues, boredom and fatigue amongst children, and the financial concerns, specifically with respect to losing a job or salary cuts and uncertainty of continuing a specific job and their regular EMIs and loans. Partnership with the government actually helped tremendously, where we knew that the escalation systems becomes a part of a necessity to run a counseling helpline. There were different reasons of why and how we needed to escalate certain issues. Some of them were specifically with regards to the access of ration and cooked meals. This was early April when the lockdown phase was also continuing to grow. Domestic violence, child abuse and child neglect, people who were experiencing suicidal ideation. There were extreme medical emergencies, and any mobility issue with respect to any hazardous location if the person was found to be any, and they were risk to their own physical or a mental well-being. Those were issues that were escalated directly in partnership with the government, and rightful support was being provided on the ground with partnering with the government facilities. I'm also going to quickly share in this about 2.5, 3 months of learning a tele-counseling services, is to be able to have a team of trained staff about what the counseling services include, how we are going to be engaging in the first aid to the people who we have never met, and we'll probably meet for that one time in that space, and to also have regular training of the staff. So every week we would consider having a group of people who were trained in suicide, in addressing the geriatric needs, in addressing what self-care and mindfulness activities mean. And so that reflection goes directly into how the counseling gets impacted with the people who would call. Secondly, constant supervision. With about 350 plus counselors, we had created a system where in a slot they would be addressing calls, and that particular slot would have about 50-60 counselors. Each of those 60 counselors would then be present to talk about their issues, the cases they felt, people that needed escalation on an immediate level, and how their counseling services needs to get more improved. So constant supervision is a key benefit of running a helpline service, specifically because a counseling service that we were offering, the telecounseling, did not include any call records. So much as the person would feel absolutely confident that nothing that I would say is getting recorded or being monitored, but definitely being heard. So from that space, if there was certain things to be addressing their critical needs, that monitoring would happen only via the information they would share, if they were willing to share any. Secondly, to tie up with the referral system, as I indicated, there were a maximum calls for the ration and the food supply medical emergencies that were being raised with different organizations and partners that we had collaborated with. The method to sort of escalate with the government agencies is, as I said before, is a key learning of knowing exactly what kind of help can be given to the person who faces more logistical based issues than more of a emotional and a mental health issue. Partner with local organization for regional context. I think we, because our helpline was available all over India, we realized that places like Odisha or Punjab or a Chhattisgarh, they needed more regional flavor in terms of dialogue, in terms of language, in terms of knowing better about their own regional spaces. And that helped by partnering with the local organization, guiding them through, allowing their learnings to come to the counselors and then dissipate the counseling services. Overall monitoring and evaluation to be able to fix and see every week that there were changes to be made, there were updates to happen, updates from the space of knowing if we were doing right. And today we are in the phase 2 of COVID response, where now our focus is only fixed to supporting people with who are quarantined and are diagnosed with COVID positive. Lastly, I think the benefit of always partnering with the state government helps, because any independent or private lines have their limitations. The government bodies receive the maximum calls and support structure every now and then, and it's easier to monitor and take that conversations forward. That's all that I have to share. I hope I'm not exceeded my time beyond 20 minutes. Do let me know if you guys have further questions. I'll be happy to sort of address them.
Thank you so much, ma'am.
Thank you.
Yeah.
Yeah,
That was
20 minutes.
that was very elaborative, Hanu. We have heard of telecounseling, and we don't know how does this happen. But you gave a complete outlook of the situations that you have handled so far. So that was really a good, very informative talk. I can say.
Sure. Thank you, Chetan.
Yeah. Yes. Okay. The floor is open for question and answer session now. So I can see a couple of questions that is being raised in the question and answer chat box. So I'll just post that to, I think that is for Dr. Seema, ma'am.
Chaitanya, I have already answered the questions which was there in the chat box.
Yes, ma'am.
If I want to read it out, or if I have to answer that,
yes,
I can answer. No worries.
Yes, please, ma'am.
Okay. That's no more shown in chat box question and answer, because maybe it's there in the answered ones.
Answered, so yeah, yes, ma'am.
Okay, the question was, how are developmental delays identified? That was the first question. I think I have already mentioned in my presentation that developmental delays are identified through a chart or a checklist, which actually the healthcare professionals will have, or the Anganwadi workers will have with them, which shows which are the developmental milestones each child should achieve at particular stages of their development. For example, as I have told, the social smile milestone should start by the age of 3 months. If the child is able to recognize the non-caregiver by the age of 3 months, it can be 3 to 6 months, but at least after 6 months, we will say that there is a delay in the development of the child. So social smile is the first milestone, which should be achieved between the months of 3 and 6. Head holding, that is again 3 to 6 months. Then rolling over, around 6 to 9 months. Standing with support, 9 months to 12 months. Then like that, for each development, there is a milestone. So there is a list of activities a child should do according to different stages of development. And if the child is not achieving such activities or the milestones at the particular time mentioned, that is known as a delay in development that can be identified in comparison with the age-appropriate developmental milestones. Next question is, are these delays permanent? Delay is just a delay. It's not a permanent thing. It is an indication that the child is not developing normally. So if the delay is being identified and interventions are done at appropriate times, it can be changed. For example, if a child is having difficulties in initiating speech milestone and the interventions are given at the early stages, the child can overgrow that and the child will learn to speak normally after getting adequate intervention. So these delays are actually not permanent. They are just delays. Is a developmental delay a disability is the third question. Developmental delay is an indication that the child is not developing normally, and if not addressed or if not corrected at the appropriate ages, that can lead to a disability. Hope that is clear for the person who asked the question.
Yes, ma'am, that sounds really clear. So there was one more question. Yeah, I think you have answered that as well in your presentation itself,
Yes.
that you have mentioned in the section.
Yes.
So I'm just looking out for any other question because we have given access to the YouTube channel as well.
Okay.
I'll just have a look at that now.
There was one more question. Hi, ma'am. My question is, what are the behavioral problems in children? If I have to answer this, the presentation will entirely go into another set of information. So behavioral problems are the problems in the normal behavior of a child. It could be a tantrum wherein the child insists that a particular need should be met at a particular time. And following that, the child may get angry, may be irritable, may roll over the floor, or may hit a parent or a caregiver. Or a child who is lying continuously could be having a behavioral problem. A child who is not trained properly to use toilet can also be termed as having a behavioral problem. So there are many things that comes under behavioral problems. So I think with that, I should better end with that question. Otherwise, it will go on.
Yeah, thank you, ma'am. Thank you for answering the questions. I hope they're satisfied with your answer. So Akriti, I think you have a couple of questions.
Yes.
One is, I would like to know whether you have used any particular counseling techniques or any specific therapeutic approaches used for telecounseling.
Yeah.
So anonymous attendee is asking that question.
I responded to that. Yes, there is a specific theme called crisis counseling and psychological first aid, which is the primary base of having any counselor first being trained, because that is the purpose of doing a crisis counseling. There are different techniques and therapies that are available, but that is specific to a kind of an audience. The counseling services that we had adopted was specifically to attend the crisis. So that's when it's a crisis counseling and psychological first aid. I think the second question the same person has asked is regards to the family therapy, if that is possible via telephone. It's not like we have not attended those, but in my experience, I don't think it is as effective as it is when to sit with the family, at least through a virtual online counseling. So I would definitely switch between a online platform than a telephonic platform for a family therapy. Within the telephonic counseling, I think there are a lot of verbal and non-verbal cues that gets missed down, and critical issues are not that gets addressed easily. So I would never sign up for a telephonic counseling for a family therapy. Having said that, I don't think it is entirely impossible. I think we are all living in a new reality of lockdown and figuring out different ways of creating awareness and getting the work across. So I'm not dimming the possibility for it, but I would say it is better to turn into a space where you and I can see each other, talk, and have a dialogue which takes it forward. Does that answer your question?
Yeah, hopefully, ma'am. So there's one more question for Akriti.
Yeah.
From Smriti Garhotra.
Sure.
Do you see that telecounseling is the way forward in counseling? If yes, then don't you feel there is lack of visual and verbal cues, and this might hamper the relationship? For example, a person is talking about an issue of what is bothering him or her, but the actual reason is not coming out in telephone.
Absolutely. I would say that in the entire interim of the lockdown, counseling has become a space where accessibility and the distancing gets minimized. So if you and I are feeling isolated and there are issues that you and I can't address at our own home boundaries, then at least there is a phone or there is a counseling, there is a online platform via which I connect to a professional. I would never say it is the future mode. I would say it is definitely one of the interim accessible spaces, because I think what Smriti is writing is absolutely correct. One would actually miss the whole visual and verbal cues, as against it is with the children or with an adult. At least I would say there is a space where they don't feel isolated or no help is available. So I wouldn't say it is the future in counseling. It is one of the ways of attending services. And highlighting this, I think I would indicate that suicide helplines have actually started for this exact reason, because there are times when a person ideations for suicide is extremely high. So that one telephonic support or one online session might be much helpful in hampering a murder attempt or an attempt to actually commit suicide. So in that facility, it is a way mode. It's a medium way to cut that extensive line of support.
That was, I think that answered the question. So there is another question for Akriti, madam.
Sure.
The person is actually appreciating your contribution during COVID situation.
Thank you.
And the question is, how did you manage to take cooperation of government in providing food and ration to the people?
Can you repeat that question for me, or if I can read?
Yeah. How can I repeat?
How did you manage to take cooperation of government in providing food and ration to people?
Right.
Early on, I think we did decide to take support from the state government. We were reaching out. I'm speaking is March, when the lockdown was only being decided. The reason why I put down the date for the lockdown phases is that by 24th, the lockdown was officially launched, prior to which we were already anticipating because of the suicides that were happening. So we decided to start off early, and I think the government was still in the interim of planning something by the time we were already ready. So sort of, I think it helped us just be, better prepared or more prepared to attend crisis situations. And that's how they gave us the lead to take this forward. And hence the partnership with the DCPCR came into existence, via which different departments within the government scheme came into existence for us. Does that answer the question?
Yeah, I hope so. Okay. Yes. There is another question for Dr. Seema ma'am.
Sure.
But I think that question is related to the autism spectrum disorder and cerebral palsy, if I have not mistaken. So would you be explaining that in detail, ma'am, or in brief?
I can just explain in brief that autism spectrum disorders are developmental disorders that actually manifest during the early years of development, around 2.5 years to 3 years. The onset of symptoms will start at that time. And it is characterized by difficulties in 3 major areas in the life of a child's development. For example, they will have difficulties in communication, difficulties in social interaction, and they will also have some repeated repertoire of activities and interests which may change their behavioral patterns. So with these 3 guidelines, we actually diagnose a child with autism spectrum disorder. And if the child, and there are certain scales or rating scales which we use to diagnose a child with autism spectrum disorder. And once the diagnosis is made clear, the next step is to start the interventions with the child. So it can be individualized intervention programs with the speech and language development. It could be behavioral therapies, and simultaneously there will be work with parents about the disability, and then what could be the ways of managing the child, or what is the importance of treatment and training, and what could be the future like. So that is about autism spectrum disorders. And cerebral palsy is a condition in which the muscular coordination is difficult for certain children. And the children with such condition will have difficulties in moving freely. They may need assistance to walk or sit upright. And they have difficulties in eye-hand coordination. And intelligence-wise, they may not be always having trouble. They can be having normal intelligence, and few have mental retardation as a comorbid condition. And they may need lots of assistive devices to make their life more easy. They need equipments to start walking, or to sit upright, or to start using their hands and other things. So their therapy will involve physical or physiotherapeutic interventions, social interventions, and psychological interventions.
Yes, ma'am. Thank you so much. Thanks to both of you for answering the questions patiently. So with this, we are going to wind up the session for today. Thank you. Thank you, Seema Madam, and thank you, Akriti Kapoor.
Thank you.
And I do take this opportunity to thank the entire team and congratulate the entire team behind that, because it's a first initiative of the department, I believe, and it has been well organized. Congrats and thank you.
Yeah, thank you, ma'am. Thank you so much.
Dear participants, I have an announcement here. Akriti, you are about to say something?
No, I just wanted to say thank you.
Please go ahead. Please go
Oh,
ahead.
yeah. So thank yous are allowed, right? Okay. No, I think thank you to Dr. Seema for a wonderful guidance on developmental delays. To Sidappa, Mother Sir, to Nandini, Chetna, and Girishji. Thank you very much. Much appreciated. Thank you.
Thank you. Thank you. So the announcement is like this. A lot of queries are coming related to the attendance. So don't worry about that. We are monitoring it in Zoom as well as YouTube. And second thing is tomorrow's session is going to be in the evening because one of our speakers is from US. She's from the North Michigan University, and that is somewhere in the northwest of US, I believe. So we are going to have 9.5 hours of difference. So we are adjusting to a time which is suitable for either of us. So that is it. Thank you. Tomorrow's session is going to be at 6:30. Okay, I'll be updating you through WhatsApp group. Thank you.
Once again, I thank all the participants and our invited speakers for making this webinar series a success for today. So with this note, we are closing the session. Thank you all.